One of my favorite areas to treat are the lips. And we see really some different requests on the lips. Some patients are complaining about lip lines. Some people are complaining that they don't have lips, or that as they've aged, their lips have started to shrivel and shrink a little bit. And injectable fillers, hyaluronic acids, are wonderful for the lips. We've got a few different products that we can use depending on what the patient wants. Someone, often a younger patient, who says, I want my lips larger, will use a product that has a little more substance and volume and body, as opposed to someone who might say, I just want them smoother, or I'd like these lines diminished. As we're injecting, I do like to use a topical numbing that increases the comfort tremendously. And I also often use a technique with a tool called a cannula. A cannula is a long needle with a rounded tip, and that allows me to put a small puncture access, one needle stick on each side, and get into the lip with the cannula without multiple needle sticks. That allows for a nice even fill and placement of the lip, less chance for bruising, less trauma to the patient. Depending on what we're trying to accomplish, I may use the cannula or I might use a needle for very specific placement. When we do filler, the biggest thing patients worry about is looking ducky and looking unnatural. That's a look I really do not like. As with other filler treatments, I prefer to be conservative, bring the patient back at 2 weeks, put a little bit more in if we haven't taken it quite far enough. There is often a worry after patients go home. It's very typical to have swelling that evening and the next day. And it's difficult not to be afraid that you overfilled your lips or that I overfilled your lips. And so I'm conservative. I tell the patients, hey, here's what we're using. This is not too much volume. Look right away afterwards because you see a pretty good effect. And then if you swell, don't freak out. It's going to quiet down. Give it a day or two. There can be bruising. If we use a cannula, that's very unlikely. If I choose a needle, you might have small bruising. Lip gloss will cover that just fine, and it'll go away within 2 or 3 days. I do recommend icing after treatment. We'll give you ice right as you leave, and I think it's nice to ice for 10 minutes for 2 or 3 times the rest of the day. Sleeping propped up can help minimize bruising and swelling, and avoiding salty foods that same evening and the next day. The fillers that we use can last up to 1 year, and I sometimes see patients where it's been 2 years and you can still tell there's filler present. But our goal with filler is to give you a nice, soft, natural, fuller lip that you love. We really are working very hard with you to avoid an unnatural, ducky look. A couple of other things about the lip area. We tend to turn the corners of our mouth down as we age, and that's because of this process of our skin sagging. So patients will come in and they say they feel like they look mean because their mouth is turning down. And we can use a little bit of filler at the corners, and there are a few different techniques that I like to use to actually lift the corner of the mouth, return it to a neutral to slightly turned up position. Again, not overdoing it. We don't want you to look like the Joker, but just bring you back to a natural, younger looking mouth. This with lip lines, this is such a common concern, and patients will complain about it before I can even really notice them. And then I put my magnifiers on and get up close and I realize, yes, you do have lip lines. So sometimes the lines are deep enough that we actually are putting the product right into that line to lift it and make it smoother. Sometimes they're very subtle, and I'll use my cannula technique to thread a little bit of filler into that upper lip. Sometimes we're actually going into the border between the white and the red, called the vermilion border. What we're doing is adding a little bit of subtle volume to that area to stretch the skin just a little bit to cause a smoothing effect. The goal is not to look like something's been placed there, but just adding subtle enough volume that the lines smooth and soften. The other things that we can use around the mouth to help soften those lines would be physician-grade skincare to help stimulate collagen, elastin, keep the skin moist and hydrated. We also do the carbon dioxide fractionated laser called the DOT in this perioral or region around the mouth. And the laser will regenerate the skin to help smooth out those fine lines and wrinkles.